I'm talking to Dr. Gene Plotkin. Dr. Plotkin is a chiropractor. Dr. Plotkin, what are your qualifications?
I'm a doctor of chiropractic, and I graduated from Life Chiropractic College West, 1996.
Great.
So
okay.
Today we're going to talk about chiropractic, and I have to give you a little bit of history on the profession. It started in 1990. However, the evidence of chiropractic was found back in the ancient Egypt, in Eastern Europe, in China. People tried to manipulate the spine from the beginning of time. Currently, in this present time, the profession is well recognized and well researched. There is much evidence about the quality and validity of the profession and how much it can help the public at this time. Now,
okay.
as far as education of a chiropractor, it's very similar to those of you who know education of medical doctor. We go through rigorous training for 4 years. Prior to that, you need a previous bachelor's degree generally in science, and the rest, 1.5 years or 2 years, depending on the school, will focus primarily on the spine, something that medical doctors generally don't do. So I would say that as a chiropractors, we're experts of knowing the spine, and I would say that we take the precedence over any other profession as far as the knowledge, education, and experience of learning about the spine.
Okay, so how can a chiropractic care actually help you?
So a lot of times, because different issues come up during lifetime, either birth, trauma, day-to-day activities, car accidents, etc., that create discomfort or pain in our spine, in our backs. Now, chiropractic profession, unlike, let's say, medicine or other fields, doesn't use any drugs or surgery, and it's basically the hands of a chiropractor who are checking the spine, checking for the areas that seem to be problematic, and then delivering a very gentle adjustment. Some people will call it manipulation. We like to call it adjustment, which will correct the misalignment of the spine and get rid of the cause of the problem. And as a result of that, the patient will feel better, will feel alleviation of the pain. And generally speaking, it doesn't take too many visits to create a change in the body. And usually the visit will last from 20 to 30 minutes depending on the problem. And generally speaking, between 2 to 3 weeks of time period when the person stops coming to the office and can return to their normal life.
Okay, great. What is the difference between physiotherapy and chiropractic care?
Okay, this is a very good question. I have to say, historically speaking, physical therapy started up as a discipline would rehabilitate the people during World War II, and is designed to work with people who are had, let's say, their limbs removed or were not able to move due to strokes or any other medical issues. Chiropractic started out as improving the nervous system by manipulating the spine. And historically speaking, anecdotal evidence, when the first adjustment was delivered, the person regained his hearing. Nowadays, we have research that shows that chiropractic adjustments or manipulations delivering to the spine can alleviate a person from other neurological issues or internal problems, etc. Physical therapy, unlike that, is mostly focused on rehabilitating the person. Physical therapists also knowledgeable about the spine. However, it's not, I would say, it's not exactly their specific training.
Okay, Dr. Gene Plotkin, thank you
My
very
pleasure,
much.
Jonathan. Anytime.